COVID-19 testing is essential to understanding how prevalent the disease is in any community, but there's a gap in time between when those tests are taken and when people start to show symptoms if they are positive.
But as Fox 6's Bill Miston explains, UW Milwaukee researchers are part of a team that's doing statewide surveillance to look for early trends in communities, and it starts at home.
From the first flush, that water and whatever's in it likely ends up here at a wastewater treatment plant like Milwaukee's Jones Island. But what you may not know is that some of that wastewater is set aside and brought to the UW Milwaukee School of Freshwater Sciences just across the harbor, where postdoctoral research assistants Adelaide Roguet and Shushin Feng don lab coats and get to work.
I remember the first time that we actually saw the first number. I mean, that's bad, but we were so happy to see SARS-CoV-2 in sewage.
Roguet and Feng part of the team behind the development of the process to test wastewater for the virus SARS-CoV-2 that causes COVID-19. Now, wastewater surveillance for pathogens is nothing new, but looking for the coronavirus is. How it works is wastewater is put through a filter that traps genetic material, including from viruses. That material is then extracted and copied to the point a machine can detect particular coronavirus genes.
The N1 gene, and this one is the N2 gene.
Once the results are in, they can determine the prevalence of the virus from a particular community's sewer shed.
This is a very quantitative method, so we can actually tell the concentration. We can't tell how many people are sick, but we can see that concentration going up or down, and that tells us the trend in the community. If more people are infected, it becomes more concentrated.
UW Milwaukee professor Sandra McClellan's lab is at the center of testing, getting wastewater from municipalities across southeastern Wisconsin up to twice a week. The work is in partnership with the Wisconsin DHS and the State Lab of Hygiene, which is testing the rest of the state.
And it really is not self-standing data, but when you pair it up with the clinical testing data and you see the same trend, you can have confidence that you're capturing what you need to capture in your clinical testing.
Results are sent to DHS to be uploaded to a statewide dashboard, which went live earlier this month. Just another tool to tracking the pandemic in the state. In Milwaukee, Bill Miston, Fox 6 News.
Now, while this wastewater surveillance doesn't intend to replace traditional testing for the coronavirus, it can provide an early warning if COVID-19 is found within a community, giving local health officials a heads up on what might be coming in the near future.